everyone, welcome to Only the Shreya. Well, if you're moving to UK, there's one thing that you have to know about before you do, and that is how the healthcare system works in the UK. To be honest, I wasn't planning on making this video at this time, but recently I was having a conversation with one of my friends who told me how he knew a person who moved with his family, a wife and a kid. He was on a work call meeting when he had a stroke, and unfortunately, he lost his life within few minutes. His wife had no idea what to do during those critical moments. This incident kept me thinking for a very long time, and I decided to make this video for everyone to know all the details about NHS, how it works, how to register with GP, what are my experiences, and most importantly, what to do if you are in such emergent situation. The healthcare in UK is managed by NHS, National Health Services, which provides a wide range of medical services to all the residents in the UK. The NHS is funded through taxation, which means there's some amount which is deducted every month from your salary for NHS. The first step is how to register with your GP. When you first come to UK, you simply have to use the NHS website to locate GPs near you. Otherwise, you can just use Google and say GP near me. It will show you few GPs which is near your postcode. You simply just give them a call or book an appointment. They'll give you time to come to their GP. You have to visit the GP and there will be few documents like your passport and proof of the address which you can provide to register yourself in that NHS. Once you fill in a form and register with your GP, it can take up to 1 to 2 weeks for the GP to get back to you with your CHI number. This is a unique number which is used across the UK. Once you receive this number, you're sorted. You are registered with the GP. You can call them for any health services. Now let me tell you how you can reach to your NHS for primary care. For example, a non-life-threatening issue like fever, cough, cold, or surgery, or diabetes, things like that, you just simply need to give a call to your GP's number on their opening times, which is usually around 8 to 10:30. You call them and book an appointment on the date that's available from their side, and you visit the NHS on that particular date. They will give you a prescription and you can just take that prescription to any of NHS medicals and you can get the prescription for free. You can also reach out to your GP to get the same prescription once again. So this was just a non-urgent situation. But what to do when it's an urgent situation and a life-threatening situation? First, you assess the situation. You have to stay calm and composed and be with the person and try to gather as much information as you can. You have to call 999 in the UK for emergency medical assistance, ambulance services, fire, or the police. Be ready to provide the emergency dispatch with your location, details about the situation, and any relevant information about the patient's condition. You have to follow all the instructions that is provided by emergency dispatcher until the help arrives. Meanwhile, try to gather all the information regarding medical history of the person who is facing the issue. And the best thing is, if you don't want to wait for the emergency services to arrive to yourself, you can try and call anyone who you know has a car who can take you to the emergency hospital, where you don't need to wait for any line or make an appointment to go. You can just simply go to the nearby hospital which takes the emergency cases. You just go there and the patient will be admitted and provided utmost care by the NHS. Well, I hope this video provided you the information that you need regarding NHS. This is it for this video. I hope to see you in the next video, and for more such updates, keep watching Only the Shreya.